On this Tuesday night, Manitoba's dire diagnosis. Hospitals buckling, cases surging, and more help is on the way.
There's hundreds of people in hospitals struggling for their lives right now.
While BC unveils its plan to return to normal by September. What's changed 1 year since George Floyd's murder?
And we all said enough is enough.
Has there been progress in racial justice? The Olympics versus the virus, fresh support to keep the games going as criticism grows.
It's going to cost lives.
And COVID climbs to new heights, the outbreak at Mount Everest.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with two different pandemic realities playing out in this country. Across most of Canada, the outlook is improving by the day, including in BC.
The circuit breaker restrictions that we put in place 6 weeks ago have accomplished what they set out to do. The light that we've been talking about for weeks and weeks now is at hand.
BC laid out its reopening plan today. We'll have more on that in just a moment. There and in Alberta, Ontario and Quebec, infection rates are dropping steadily. Vaccinations are accelerating, hospitalizations are dropping, and restrictions are easing. Except in Manitoba. It is still dealing with a surge in new infections, and people are becoming seriously ill. Hospitals in Manitoba can't handle them all. 23 critically ill COVID patients have now been airlifted hundreds of kilometers away to hospitals in Ontario. Doctors say other Manitobans waiting for non-COVID urgent surgeries have been left to suffer.
It is clear that cancers are progressing and are not being operated on. People who have aneurysms, the aneurysms are bursting at home and people are dying. 6 patients have already died on the cardiac surgery waitlist.
The Manitoba government did extend its ban on outdoor social gatherings until Saturday. Doctors, though, say that doesn't even go close to far enough. They want a complete stay-at-home order imposed immediately. Brittany Greenslade has our top story tonight.
As quickly as new beds in Manitoba intensive care units are created, they're being filled even faster.
People who are currently on ventilators or who are unable to talk because they're gasping for breath, they're on oxygen, they're lying on stretchers in our emergency rooms.
ICU capacity has increased by 150%, but it's still not enough to handle the surge.
Hospitals are being stretched to the limits right now. There's hundreds of people in hospitals struggling for their lives right now.
The federal government is sending help, including 12 critical care nurses within the week.
The government of Canada is preparing to deploy additional federal health resources, including medical staff through the Canadian Red Cross and the Canadian Armed Forces. The Armed Forces will support vaccine rollout in 23 Indigenous communities in Manitoba.
In the first 3 weeks of May, 170 patients have been admitted to the ICU, more than triple last month's patients.
These patients are critically ill, they're younger and younger, and what is tragic and what is heartbreaking for the staff, these patients suffer with their illness alone.
Alone, and for many, now hundreds of kilometers from their loved ones. 23 Manitoba ICU patients are now spread out among 8 different Ontario hospitals. Others could be on the way to Saskatchewan within the next 24 hours, and North Dakota is on standby.
Just imagine for a moment what that would be like to have a loved one put on a plane, shipped to another province or state, and you might never see them again.
Surgeries are once again being delayed, creating major problems for others who are also being sent out of province for treatment.
There are people now who are waiting to have their spines operated on that are losing control of the bowels and bladder and becoming paralyzed. And in fact, the province has now started transferring these patients to U.S. institutions for surgery.
It's a dark tunnel Manitobans are trying to find their way out of. Tuesday, a group of doctors called for a stay-at-home order and the closure of non-essential businesses. While some public health orders are yet again being extended, it might not be enough to help a collapsing healthcare system. Brittany Greenslade, Global News, Winnipeg.
There is steady progress in getting Canadians vaccinated. Over the last 5 days, an average of 387,000 doses were given per day. 52% of Canadians have now had at least one dose. 4.4% have been fully vaccinated. In British Columbia, officials say there's been so much progress with vaccinations and slowing down infections, they are ready to begin reopening.
This is indeed a good day, and one that I've been waiting for a long time, as I'm sure many people in British Columbia have too.
Eric Sorensen has the details on BC's four-step plan to normal life and how other provincial plans compare.
More than 60% of adults in BC are now vaccinated, and with COVID cases and hospitalizations stabilized, the province is beginning to reopen. Personal gatherings can expand to include 5 visitors or 1 household. Organized gatherings outdoors can be up to 50 people. Outdoor sports return with no spectators, and indoor faith gatherings with limited capacity. There's more, but you can hear the relief in the Premier's announcement.
We have made extraordinary sacrifices as a province and as a people over the past 15 months, and nobody is more excited than the 4 of us.
Dining, indoors and outdoors, is back with up to 6 people per table. Fable Diner is looking forward to welcoming more staff and customers.
I think people are wanting to go out to eat now, so I think it's potentially could be a great summer for the industry.
BC is tying its reopening not to dates, but data. Travel restrictions between regions, for example, will be lifted when a threshold of 65% of British Columbian adults are vaccinated.
With more and more people getting vaccinated every day, we can gradually restart our important social connections, the businesses, the activities that we have been missing for so long.
Quebec is also reopening this week. Starting Friday, the province's curfew will be lifted, and outdoor patios at restaurants can reopen.
I'm really proud of Quebecers. So we're moving forward with our gradual reopening plan.
In BC and Quebec, the third wave crested in mid-April. The COVID case numbers now as low as they were last fall. In Alberta, the wave peaked in May, but has dropped dramatically since then. In Ontario, the third wave persisted with much higher numbers for weeks, but for the vast majority of Canadians, the trend is clear. The waves are all breaking. Alberta's remarkable turnaround saw schools reopen today in most of the province, barely 2 weeks after students were sent home. Ontario has begun gradually reopening, starting with outdoor recreation that saw hundreds of thousands outside on the weekend.
While you're out and doing more things outside, still stick to the household. Still watch the distancing, the masking.
Provinces are reopening on different timelines, but for most Canadians, it is just a question now of how quickly normal life returns. Eric Sorensen, Global News, Toronto.
Ontario has recorded its first death linked to the AstraZeneca vaccine. The province's associate chief medical officer says a man in his 40s died a few weeks after getting his first dose. He developed a rare case of vaccine-induced blood clotting known as VIT. 5 deaths are now linked to the AstraZeneca vaccine in Canada. The first Ontarians who got AstraZeneca doses in March are now eligible to book their second shot. Many report a lack of clarity today around the booking process. Ontario has a stockpile of 45,000 doses of AstraZeneca that is set to expire in about a week. There could soon be another COVID vaccine available for kids as young as 12 in Canada. Moderna says a clinical trial of its vaccine in nearly 4,000 kids triggered the same signs of immune protection as it does in adults. Moderna says the preliminary results show no cases of COVID-19 among kids aged 12 to 17 who got 2 doses 4 weeks apart. And they say the vaccine was 93% effective 14 days after the first shot. Side effects are mild, headache, fatigue, and chills. Moderna says it will submit the findings to international regulators in early June. Right now, only Pfizer-BioNTech is approved for use in Canada on kids aged 12 to 17. Now to the memorials and the marches honoring and mourning George Floyd. 1 year since he was murdered, the intersection in Minneapolis where it happened is still closed. It's from here that the outrage and the impetus to end police brutality emanated and spread all over the world. Today, Floyd's family went to the White House for a private meeting with the president and vice president. The family described their conversation as productive and say they believe the president is genuine in his concern.
Say his name.
George Floyd.
Thank you all.
Before leaving the White House grounds, Floyd's daughter Gianna led a chant that raised fists for the family members who could not be at the meeting. Biden has pledged to fight long-standing racial inequality in America, though as Jackson Proskow reports, legislative action has been slow, and a warning some of the video in his story is disturbing.
It's time
for a change.
As a celebration of life unfolded in the city where George Floyd was murdered,
So we're going to have this moment of silence.
Floyd's family met privately with President Joe Biden after walking the halls of power, pressing for change.
People realize what's going on in America, and we all said enough is enough.
This was the moment 1 year ago when many Americans woke up to reality.
Wake up! Wake up!
25 million marched in the weeks that followed. The trial and conviction of former police officer Derek Chauvin was the beginning, not the end, of the fight for justice and equality.
Until this point is moot, we're still going to be out here.
Aaron Xavier Wilson joined last summer's protests in Washington.
Black Lives Matter!
1 year later, he's unsure many Black Americans will ever see a different reality.
There's a lot that hasn't changed, and we have a lot still left to go than to bring the same sign out and make the same point.
The Biden administration has pushed Congress to pass the George Floyd Justice in Policing Act. It's still stalled. It would create a national system to track misconduct, end certain legal protections for police, and focus on combating racial bias.
People are having conversations about systemic racism and policing that they never had before. All of this points towards a likelihood of much more broad change.
Law professor Justin Hansford believes there's actually reason for optimism, thanks to the size of the movement that erupted and the awareness created by the video of George Floyd's final breaths.
And we're going to see if that is going to be enough to totally create this environment where people like myself can feel safe when we're interacting with police officers.
What that change looks like is still the big unknown. For all the talk of abolishing or defunding police, that has not happened. Instead, some U.S. cities have taken concrete steps to improve accountability and redirect resources to training, mental health, and community initiatives, changes that 1 year ago would have been unthinkable. Spaces like Black Lives Matter Plaza here outside the White House are now permanent installations, but many activists point out this movement came precariously close to not happening, except for that one brave bystander who took and shared that video of George Floyd's final moments and spread it around the world. Donna.
All right, Jackson Proskow in Washington, thanks. Prime Minister Justin Trudeau is condemning the government of Belarus over its brazen detention of a journalist who had been living in exile. The international flight he was on was diverted by a fighter jet and forced to land in Minsk. Trudeau called it outrageous and illegal.
This was a clear attack on democracy and on the freedom of the press. We condemn it and call for his immediate release. We also condemn this kind of dangerous interference in civil aviation.
The Prime Minister added Canada has existing sanctions on Belarus and he will examine further options. Well, the Olympics have found an unprecedented competitor in COVID. Coming up, how the IOC is trying to shore up support for the Tokyo Games. Plus, blocking bans, new laws in Florida to prevent social media companies from silencing politicians. An ultramarathon in China has ended in tragedy. 21 runners died when an unexpected storm hit. But a shepherd is being hailed as a hero for rescuing 6 other runners. The shepherd says he's just an ordinary person who did an ordinary thing. He went to help when he heard shouts at 2 a.m. He took a group of runners into a cave and lit a fire to keep them warm and dry their clothes. The race to the Tokyo Olympics is running into more objections. International spectators were already banned from the Games, and now the U.S. has told its citizens to avoid all travel to Japan. It doesn't mean athletes aren't going. They'll all be fully vaccinated. But the surge in COVID cases in Japan has led to a flood of calls to cancel the Games. As Crystal Goomansingh reports, the Olympic Committee's view is the Games must go on.
A ride to a park and ride. The president of the Tokyo Games is being briefed on every detail. Questions to her, however, focus on the game being a potential vehicle for viral spread. Mass vaccination centers just opened in Tokyo and Osaka as Japan struggles with a 4th wave of infections. Beds and ventilators are in short supply in Osaka. Hospitals are overrun with seriously ill patients. Still, International Olympic Committee officials are championing the Games, which are now less than 9 weeks away.
In this final stretch, our top priority continues to remain on organizing safe and secure Olympic Games for everyone.
Not only did the president of the IOC speak publicly, but in what can be seen as an effort to galvanize support, the Olympic organization also released messages from 2 high-ranking public figures.
Sport brings us closer as a global community.
And the world of sport has been a beacon of light to guide us forward.
Despite the new U.S. travel warning, American athletes will be heading to Japan, and so will Canadians. There are plenty who want the 2020 Olympics canceled, including Japanese citizens and local and foreign public health officials.
I think it's absurd to have the Olympics at the present time. I mean, if you think of the 2 key features of the Olympics, they involve a huge amount of international travel and mass gatherings.
Roughly 80,000 people are expected to attend the Games. A key to the IOC's safety plan is to have athletes vaccinated. 3 different vaccine manufacturers have offered shots to ensure that can happen. Crystal Goomansingh, Global News, London.
Ow! Ow, Charlie! Ow!
I had Goodbye Charlie, why this lovable viral video is being pulled from YouTube.
Charlie bit me.
Who can forget Charlie, the finger biter? It's one of the first videos to go viral, which makes this a piece of internet history. It's been watched more than 880 million times, but it's now going to be removed from YouTube because the family has sold it as an NFT or non-fungible token for more than $760,000. NFTs are a growing trend in the digital art world. It's like a certificate of authenticity stamped into a blockchain, and it's lucrative for those who own the viral clips. Oh, you just want to hear more of that. Florida's governor wants to stop tech companies from deplatforming political candidates to prevent what's happened to former President Donald Trump. Companies like Twitter, Facebook, and Google, which owns YouTube, could face fines of $250,000 a day if they permanently delete or ban the account of a statewide candidate for office. The fine is $25,000 a day for other candidates or elected officials. In signing the bill into law Monday, Governor Ron DeSantis took a swipe at what he calls Silicon Valley elites.
Silicon Valley thinks they know better than you. So their power up to this point has effectively been unchecked, and they have used this power in Silicon Valley to impose their orthodoxies and their ideologies on our public square.
It's the first such law in the United States, although Texas is considering something similar. Republicans have long accused social media platforms of censoring posts from conservatives. Studies have found the opposite is true, that the platform's algorithms regularly amplify right-wing viewpoints. In January, then President Donald Trump was banned from Facebook, Twitter, and other networks in the wake of the January 6th attacks on the U.S. Capitol building. Cruise ships are still banned from Canadian waters, but the Alaska cruise season is going ahead thanks to a new U.S. law allowing vessels to bypass Canadian ports. President Joe Biden signed the legislation Monday. It allows foreign registered cruise ships to travel directly to Alaska from the United States without docking in BC. It's meant to be a temporary measure. Canada is expected to lift restrictions in 2022. BC Port authorities expressed concern about the law setting a long-term precedent, though, and Premier John Horgan is discussing it with Alaskan lawmakers. Outbreak at Everest. Up next, COVID-19 creeps up the world's highest peak. COVID-19 has reached every corner of the planet and now even its highest peak. Mount Everest is dealing with an outbreak among climbers. At least 100 people are believed to have contracted the illness at base camp, adding to an already dire situation in Nepal. The tiny Himalayan nation had 247 new cases per 1 million people yesterday. That's according to Our World in Data. And that is higher than India and way above Canada's 47 cases per million people. Yet the lure of Everest persists. As Mike Drolet reports, those who seek the summit may be contributing to the surge in COVID-19 cases.
Every climber has their own reason for reaching the peak of Mount Everest. 3 years after suffering a heart attack, you could say Edmonton's Leo Naiman had something to prove.
Base camp.
A month ago, the 51-year-old was in high spirits. His dream was within reach. And then 2,000 meters shy of the summit, food poisoning sent him home.
I never in my life ever experienced something like that.
That was 3 weeks ago. 3 days ago, he reached out to his expedition manager to see how he was doing. The response left him stunned.
His son tested me and said, no, he's no longer with us. He died of COVID-19.
After the 2020 climbing season was canceled due to the pandemic, Nepalese officials issued a record number of permits for this year. Millions of dollars and a good portion of the local economy was at stake. When Naiman arrived in Kathmandu, he saw the disregard for COVID protocols. So he put ropes around his encampment to protect his expedition, despite what officials were saying.
There's always this secrecy, you ask the question, hey, how is COVID-19? No, we're good. Base camp is good.
And we now know it wasn't. For weeks, climbers have been leaving Everest, either because of an outbreak or in an attempt to avoid it.
We have at least 100 people, minimum, positive for COVID in base camp. And then the dark number might be something 150 or 200.
Yet even with Kathmandu hospital beds and oxygen in short supply, Nepalese tourism officials say there's nothing to see. Rumors, as this man sees it. All this Canadian climber sees is a good friend lost to COVID-19. Mike Drolet, Global News, Toronto.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is this mural in downtown Halifax, a tribute to Nova Scotian Crystal. Thanks for watching. Bye-bye.